I'm Charles Alessi, Chief Clinical Officer of HIMSS, and I'm here talking to Ilker Ko, who is the Technology Transfer Officer at Medipol University in Turkey, in Istanbul. And we're here in Sitges in Barcelona for HIMSS 18. So you have performed something extraordinary with your hospitals. You have actually managed to do something which a lot of people would only dream about. And that is take a whole country up a level of sophistication and exchange and digital implementation and transformation. So you really need to talk to us about how you managed to bring 150 hospitals to this high level in such a short space of time.
Yeah, thank you. First of all, I thank you for this opportunity. Actually, in Turkey, many things started in 2003 with the health transformation program. Before digital transformation, we initiated a health transformation program. And after achievement of this program in many areas, such as family physician information systems and hospital information systems, some national information systems based on some national standards, gathering data from all hospitals and so on. And after that, the Minister of Health realized that there should be something more within the hospitals in order to improve the healthcare quality and patient safety. Yeah. And then HIMSS came Turkey and made an agreement with the Minister of Health to help us. And this agreement was 5 years agreement. And then Minister of Health initiated some studies on the hospitals. So we can say that Turkey is the only country using EMRAM model for making digital transformation in public hospitals. That's why this is I guess, the main difference of Turkey from other countries. I think that this is the key factor of our success.
But what you have actually managed to achieve is quite a lot, because you have a standardized system where you can honestly measure a hospital with a hospital on the basis of their outcomes, not based upon opinion, but on objective estimation, which is what EMRAM is. And I think it would help us to understand a little bit more about this as well, in terms of the input from the university, for example, and how did that assist the process?
Yes, I think this is the second difference characteristics of Turkey from other countries, maybe, because as Istanbul Medipol University, we involved this study at the beginning of last year, and after that we realized that we have been explaining everything about the EMRAM and HIMSS and so on, not only from the benefit perspective, but also the definitive side of EMRAM and stage requirements and so on. And we are explaining everything or giving some trainings to the people working within the hospital, but not to executives. Yes. And we organized 10 regional workshops in Turkey with only the managers, executives of hospitals. And we showed that the meaningful usage of electronic medical records will really beneficial for improving healthcare quality and patient safety based on the literature. We showed some measurable things to them to convince them, first of all, about the benefits of meaningful usage of electronic medical record. And after that, we showed that EMRAM is an analytical tool to measure the meaningful usage of electronic medical record. I think this worked to convince them. And here there is a gamification, by the way, among the executives. So they realized that I can do it. And after that, the Minister of Health set a target for all public hospitals. He said that we should have at least 100 public hospitals with stage 6. And after that, many executives of hospitals tried to achieve stage 6.
And then it became a race.
Yeah.
And that,
Yeah.
and that is really, I think that is really what a lot of European countries can learn
Yeah.
from what you did.
I hope so.
Because you basically set a parameter, you set a standard, you announce the standard, and then people want to be the best,
Yeah.
want to do the best. And I think you've really achieved that absolutely beautifully in Turkey.
Yep. Thank you.
Now, we also need to look to HIMSS Eurasia 18 from the 25th and 27th of October. What are the plans? What are your plans then? What are you going to show?
We have been organizing such events in Turkey for the last 4 years, but it was HIMSS Turkey event. But this year, this is the first time that we expand this event to cover the regional countries. That's why we call it as HIMSS Eurasia event.
Yes.
So we invited 40 different countries, and they will send their delegates, official delegates, to our event. And we hope that actually at the beginning, one of the main aims of the Minister of Health was to show their capacity and to export their experience to the regional countries. I guess this event will be a beginning for that, to share our studies and experience and get to learn something, of course, from others as well.
And it's a wonderful opportunity for us all to learn from you, to share best practice, and to continue the excellent work that you've started. It's been an absolute privilege speaking to you.
Thank you so much.
Thank you.